Welcome to the presentation on medical terminology. This session will help you understand the key terms, symbols, and abbreviations used in the medical field. Medical terminology forms the foundation for effective communication in EMS. This knowledge ensures you can accurately document and share information with other healthcare professionals. As an EMT, a strong working knowledge of medical terminology is essential. This includes understanding key terms, symbols, and abbreviations. Medical terminology can be mastered by learning how terms are formed and understanding the meanings of their components. This leads to effective communication within the healthcare team. Medical terms are made up of distinct parts that perform specific functions. Altering or removing any part can change the word's meaning entirely. The main components of medical terms include the word root, prefix, suffix, and combining vowels. These parts define the term's meaning. The combination of these parts determines the word's meaning. Spelling is crucial, as even small changes can alter the context. Understanding anatomy and how medical terms are used in context helps ensure accuracy in communication. Word roots form the foundation of a medical term, often indicating a body part or organ. They are the main component around which the term is built. Adding prefixes or suffixes modifies the term's meaning. For instance, cardiopulmonary combines cardio, meaning heart, and pulmon, meaning lungs. Prefixes appear at the beginning of a word and describe location or intensity, providing specificity to the term. Suffixes appear at the end of a word and typically indicate a procedure, condition, disease, or part of speech. Combining vowels, usually mo, connect word roots to suffixes or other roots, making terms easier to pronounce. Prefixes are always at the beginning of a term, while suffixes are at the end. Combining vowels are used when a suffix begins with a consonant or when combining roots. Medical terms change when converted from singular to plural. For example, words ending in "the" change to "ae", and those ending in "us" change to "I". Prefixes can indicate numbers, colors, positions, and directions, adding clarity and specificity to medical terms. Numerical prefixes indicate quantities or divisions, such as uni- for 1, bi- for 2, and multi- for many. Certain word roots are used to describe colors. Examples include cyan/O for blue, erythr/O for red, and melon/O for black. Prefixes can also describe positions, directions, or locations. Examples include ab- for away, ad- for toward, and trans- for across. Directional terms are essential for describing injury locations and pain patterns within the body. Examples of directional terms include right and left, superior and inferior, lateral and medial, proximal and distal, and superficial and deep. Additional terms include ventral and dorsal, which describe the front and back of the body, as well as palmar and plantar, which refer to the hands and feet. Superior refers to structures closer to the head, while inferior refers to those nearer the feet. These terms help define relationships between structures. Lateral structures are farther from the midline, while medial structures are closer to the midline. This distinction aids in precise descriptions. Proximal indicates a structure closer to the trunk, whereas distal refers to a structure farther from the trunk or closer to the extremity's free end. Superficial describes structures closer to or on the skin, while deep refers to those farther inside the body or tissue. Ventral refers to the anterior or belly side, while dorsal refers to the posterior or spinal side. These terms are frequently used in anatomy. The more common terms for ventral and dorsal are anterior, meaning front, and posterior, meaning back. Palmar describes the front region of the hand or the palm, while plantar refers to the bottom surface of the foot. Apex refers to the tip of a structure. For example, the apex of the heart is at the bottom of the ventricles. Movement terms include flexion, which is the bending of a joint, and extension, which is the straightening of a joint. Other terms include adduction, meaning motion toward the midline, and abduction, meaning motion away from the midline. Bilateral refers to structures appearing on both sides of the midline, while unilateral refers to those appearing on one side only. Anatomic positions describe how the body is positioned. For example, prone means lying face down, and supine means lying face up. The Fowler position involves semi-reclining with the head elevated. In the semi-Fowler position, the patient is at a 45-degree angle. The high Fowler position involves sitting upright at a 90-degree angle. Medical terms can be deciphered by breaking them into parts. Start with the suffix, followed by the prefix, and then the root. Take nephropathy as an example. The suffix pathy means disease, the root nephr means kidney, and the combining vowel o connects the terms. Together, nephropathy means disease of the kidney. The term dysuria breaks down as follows. The suffix ia means condition, the prefix dis- means difficult or painful, and the root ur refers to urine. Dysuria means painful urination. Hyperemesis combines hyper- meaning excessive, and emesis, meaning vomiting. Together, it means excessive vomiting. Analgesic breaks down into and meaning without, alges meaning pain, and ic meaning pertaining to. Analgesic means pertaining to no pain. Medical abbreviations, acronyms, and symbols are used to communicate more efficiently, but accuracy should never be sacrificed for speed. Abbreviations shorten words or phrases for documentation. Always use standard and accepted abbreviations to avoid errors. Symbols are also used as shortcuts in medical communication. Ensure that only widely accepted symbols are utilized to minimize confusion.